Good morning. Thanks for joining us this morning. I'm going to talk today about common conditions of the colon and good colon health in general. So the colon is part of the body's digestive system. And the digestive system has the function of removing and processing nutrients, and they help pass waste material out to the body. That's sort of its general function. Now, as far as how do we know something might be wrong with the colon? These are some common symptoms that we might experience. One is diarrhea, and of course that's bowel movements are too frequent or the consistency is too loose. This can be related to too much fiber, different types of foods, also medications. Another symptom of trouble with the colon can be constipation. Again, this can be related to medications often, also to variances in fibers and different foods we eat. What I will talk about today is some common non-cancerous condition of the colon. The first one will be colitis. In medicine, anything that ends with itis usually tells you that we talk about something that's inflamed, and that's no different here. Colitis essentially just means that we have an inflamed colon. The other entity that can cause infection of the colon is what we call inflammatory bowel disease. There's two types of these. Ulcerative colitis is one subtype, and Crohn's disease is another subtype. Generally speaking, this is inflammation of the digestive tract, and there seems to be a genetic component. It tends to run in families. And we think that it is really a dysregulation of the immune system. We'll move on to diverticulosis, which is a very common problem actually. So diverticulosis is a formation of lots of tiny pockets in the colon lining. We call these pockets diverticula, and you can see those on the picture here. They can range in size. Sometimes they're very small, or they could be much, much bigger, like walnuts or even bigger. They're formed by increased pressure on weakened spots in the lining of the colon as stool moves through over time. Now, thankfully, most people who have them never have any complications with them. They don't even know they have them unless we find them on a colonoscopy. So colon polyps, essentially we have a nice little picture here in the colon lining. It's a mushroom-like growth most of the time of the lining of the colon. Many of these have the potential to grow larger over time and then to turn into colon cancer, and that's why we're concerned about them. And this is what we remove during our colonoscopies, and many of you have probably had this done in the past. People over 50 we know are more likely to get colon cancer than people who are younger. We recommend routine colon cancer testing for everyone in the population over the age of 50. Just wanted to touch briefly on some prevention for colon cancer. The National Cancer Institute recommends a low-fat, high-fiber diet that includes at least 5 servings of fruit and vegetables each day. Of course, limit red meat intake. Also, getting regular exercise is very good for your colon health. And to not smoke or give up smoking is also something that's very good for colon health.